everybody, Bonnie Goldstein here. Welcome to my YouTube channel, Cannabis is Medicine. And in this video, I'm going to talk about cannabigerol, one of my new favorite cannabinoids. If you're not familiar with me, I've been a California licensed physician since 1990. I was trained at Children's Hospital Los Angeles as a pediatrician and went into critical care transport and pediatric emergency medicine. And I was in that field for about 14 years. In 2008, I made a switch to work in the cannabis world, and I became medical director and owner of Canna Centers, a Los Angeles-based cannabis specialty practice where we help adults and children use medical cannabis with success for serious and chronic illness. I'm on a number of boards and so on, and this is my book, Cannabis is Medicine, which really does give you a very good understanding of your endocannabinoid system and how to use cannabis as medicine. And so let's go on here. So cannabigerol, CBG. So this was first discovered in 1964 by Israeli researchers. And the way you get CBG is not in the raw flower. The raw flower has what's called cannabigerolic acid, which is the parent compound to all the cannabinoids. In its raw form, it's got the A acid, and when it is heated up and decarboxylated, it loses a carbon and 2 oxygens. It turns into CBG. CBGA, as I mentioned, is also the parent compound to CBDA. So when it's exposed to an enzyme CBDA synthase, it turns to CBDA, and if you heat that up, you get CBD. And then not shown on here, there should be another arrow this way, with THCA synthase, the enzyme that converts CBGA to THCA. And then if you heat THCA up, you get THC. So that's where CBG comes from. And CBG is somewhat understudied, but we do have a lot of details about some of the targets in the brain and body. So I'm going to go through those. So first, we're going to look at the cannabinoid receptors, because of course that makes sense. It's a cannabinoid. Does it target the cannabinoid receptors? And it's interesting, the research is somewhat conflicting, depending on the dose and the design in the actual study. Because remember, not every study is the same. CBG was shown both to bind to and block type 1 cannabinoid receptors, which are the most common in the brain, and also to bind to type 2 receptors, which are more in the body, but there is some overlap. We know CBG is non-intoxicating, so it's unlikely to significantly bind to the type 1 receptor the same way that THC does. And so obviously a little more research on this would be very nice to add to our understanding. We also know CBG targets endocannabinoids. So how does it do that? CBG blocks the enzyme that breaks down one of your endocannabinoids called 2-AG. And CBG also inhibits cellular uptake of anandamide. Both 2-AG and anandamide they're the well-known endocannabinoids. And remember, your body makes these compounds in response to a trigger. They bind to cannabinoid receptors, and then enzymes break them down. We know that some people can be depleted in their anandamide and 2-AG, which can lead to conditions like anxiety and pain. And so CBG blocks these compounds from being broken down or taken up, meaning they can hang around longer. So CBG enhances your natural endocannabinoid function, and CBD does the same thing as well. Another target of CBG is something called the TRP channels, or transient receptor potential channels. CBG activates a handful of these, which are involved in pain and inflammation. So when CBG activates these, turns down pain and inflammation. CBG blocks one particular one called the TRPM8. This channel, when triggered, when activated, pushes for cellular growth, which can be bad for cancer. So CBG blocking this particular channel leads to anti-cancer effects. And I'll mention some things about cancer later on in the talk here. CBG also targets GABA. Remember, GABA is a neurotransmitter, brain chemical. It works to kind of calm and inhibit overexcited messages. So CBG blocks the uptake of GABA, allowing GABA to hang around longer, giving a calming effect. CBG also targets serotonin receptors, specifically 5-HT1A. CBG blocks these receptors, and these receptors are involved in mood, pain, cognition, memory, nausea, cardiovascular function. There's one report that CBG may potentiate medications that target serotonin. So someone who may be taking a SSRI antidepressant may take a small amount of CBG and see some real improvement there. And it may be that the CBG is making the pharmaceutical work a little bit better since there's this potentiation of effects. Now let's talk about PPARs. PPARs are these receptors that sit on the nucleus inside the cell. It stands for peroxisome proliferator activated receptors. It's a real mouthful. Anyway, these are involved in regulating energy production and lipid metabolism, also involved in inflammation. And very recently, there's been a number of papers on how they affect immune function. And so CBG binds to these receptors, activating them, and it's thought to provide anti-inflammatory and neuroprotective effects. And then alpha-2 adrenergic receptors. So these receptors are involved in blood pressure, pain, anxiety, and ADHD. And CBG is the only cannabinoid known to bind to these receptors. So that's kind of interesting and unique about CBG. Now I'm going to go over some other research, sharing with you what we have found over the years. And you can see a lot of this research is just from the last decade. So we're catching up, so to speak, considering that this was a compound discovered in 1964. So there's a study from 2011 that showed that CBG blocked the anti-nausea effect of CBD in mice. So both of these compounds target the serotonin receptors, but remember CBD activates serotonin, 5-HT1A, and CBG blocks it. So there's a, they kind of negate each other. I have not seen patients using CBD for nausea who have added in CBG lose the effect. So I'm not sure that this is a crossover into humans, but also I don't see a lot of people using CBD for nausea in my practice because I recommend THC because it can be very effective at low doses, and also CBDA at very low doses can help with nausea. So I don't often use too much CBD in my recommendation for anti-nausea. But certainly this is something to think about if you are using CBD and it's effective for nausea treatment for you. You may want to reconsider using CBG only because you may lose that effect. It's not been described. And I've talked to other colleagues who work in this field and they haven't seen it either, but it's certainly something to keep an eye out for. In 2013, in a mouse model of colitis, CBG was found to increase the rate of recovery in the colon. It was also effective as a treatment to prevent colitis-associated damage to the tissues. In 2015, a study showed that CBG prevented brain cell death, reduced inflammatory markers, and improved motor deficits in a mouse model of Huntington disease. This is a neurodegenerative disorder that can be quite devastating. And here CBG has been shown, at least in mice, to help improve some of the devastating abnormalities that they find with Huntington. And then in 2019, a study showed that the combination of CBG and CBD was more effective at decreasing brain inflammation, what we call neuroinflammation, in a laboratory model of neurodegenerative disease, in particular ALS, which is Lou Gehrig's disease, than either one taken alone. And certainly this synergy of compounds I have seen in practice really work well for many different conditions, and it kind of goes to the entourage effect, if you're familiar with that. A little more research. So just a few years ago, CBG was found to lessen the decreased appetite and weight loss and partially normalize the metabolic dysregulation caused by a chemotherapy called cisplatin. This was in mice, but to be able to take a natural compound to help reduce some of the unwanted side effects of a heavy chemo, wouldn't that be nice? And then we have just a couple years ago, again, in a mouse model of colitis, orally administered CBG reduced colonic inflammation. So now we have 2 studies showing that. And in this study, they did not find the same effects with CBD. And interestingly, they added fish oil to the treatment, and that increased the anti-inflammatory effects of CBG. So that's a very nice supplement to take anyway, fish oil, but think about CBG and fish oil together for inflammation of the colon. And then here's another study, very recent. CBG, when combined with THC or CBD, reduced the viability of glioblastoma tumor cells, as well as glioblastoma stem cells. So 2 kinds of cancer cells. The tumor cells are more responsive to chemo and radiation. The stem cells are like those very difficult, resistant cancer cells. That's why a lot of people have a relapse or recurrence, because the stem cells never really went away. And interestingly, they found the combination of CBG and THC was more efficient than CBG and THC. Now we're going to talk about metabolic syndrome. So what is metabolic syndrome? This is a syndrome that unfortunately we see a lot in the United States. Insulin resistance, obesity, hypertension, high levels of the LDL, which is the bad cholesterol, and low levels of HDL, which is a good cholesterol. And insulin resistance means that your cells are just not responding to insulin. The sugar is not being moved into the cells, which is what insulin is supposed to do. So a couple of studies. So the first one, CBG by itself and in combination with CBD, increased insulin sensitivity through the action at those PPARs. Remember, those are some receptors that sit on the nucleus of the cell wall, the cell wall of the nucleus. And it was the same action as this particular drug, and I'm not sure if I'm saying it right, rosiglitazone, which is a drug that's out there on the market being prescribed for metabolic syndrome. And by the way, this drug has a lot of problems. It causes significant cardiovascular unwanted side effects. So, you know, it would be nice to have the research on CBG in combination with CBD to see if we could get similar results with, again, natural compounds versus pharmaceutical with unwanted side effects. And then another study, CBG, showing that it acts at the alpha-2 adrenergic receptor, and this may modestly lower blood pressure. So for those people who have mild blood pressure elevation, potentially CBG may be something to add to the regimen. It would be nice to have a human clinical trial on that. And then let's talk about antibacterial effects. So many of the cannabinoids, we don't talk about this too much, but they are antifungal and antibacterial. And so a study back in 2008 showed that CBG had potent effects against an antibiotic-resistant Staph aureus. And CBG was more potent than multiple other antibiotics, including norfloxacin, erythromycin, tetracycline, and oxacillin in at least one resistant strain of Staph aureus. And then another study showed CBG is effective as vancomycin, which is a pretty common antibiotic at reducing Staph aureus in a mouse model of infection. And I just want to show you this curve here. So this is colonies of bacteria, and this is these, what they call their Staph aureus persisters. They're pretty resistant bacteria. And they compared, as you can see, they had a control. They had different dosing of CBG, and then they had oxacillin, a very common antibiotic. And what you can see here, so the control is the black line with the little dots, and then the CBG in low dose is up here as well, and the oxacillin up here. So as you can see that over time, the number of bacteria did not go down. But you can see here with the high dose, so the upside down triangle here, you can see that with the high dose CBG, basically what you could see is that CBG eradicated this population of Staph aureus resistors within 30 minutes, whereas the oxacillin antibiotic didn't show any activity. And even smaller doses also helped eradicate some of the bacteria. So this is fascinating. We have a problem in our country and around the world with antibiotic resistant Staph aureus and other antibiotic resistant bacteria as well. And we absolutely should be exploring the cannabinoids to see if we can get control of these resistant bacteria. And certainly CBG has, here in this study, certainly did more than what was expected. Now let's look at psoriasis. So what is psoriasis? It's an autoimmune condition, and people who have this end up with this very significant kind of nasty looking skin rash. And what it is a hyperproliferation of skin cells called keratinocytes, which is the most prominent cell, skin cell. You also can get arthritis with psoriasis, so achy joints. Interestingly, in 2007, a study showed that CBG, as well as THC, CBD, and CBM, inhibited human keratinocyte proliferation. Also, CBG was found to repress the transcription of genes that regulate keratinocyte growth. So the genes that might be driving those cells, those skin cells, to multiply and really proliferate, CBG was found to kind of tell the genes not so much. And then very interesting, a very recent article showed that CBG regulated more genes than CBD, including those that target skin. Also, CBD and CBG both reduce inflammation in this condition better than vitamin C. CBG inhibited pro-inflammatory cytokines. So cytokines are compounds that your body makes to create inflammation. So, when you get a bug bite, there's, you might get a big red welt or something. That's cytokines at action. In fact, with COVID, we know that when COVID hits somebody hard, their body's inflammatory response goes crazy, producing all of these cytokines that actually create more illness. So although pro-inflammatory cytokines are needed so that we know when we have inflammation, when they go out of control, that's when we get into trouble. And CBG inhibited these compounds that were created in response to inflammatory triggers like ultraviolet light A and ultraviolet light B in bacteria. And also, interestingly, CBG was applied topically to human skin that was given like a chemical to create inflammation. And the skin showed statistically significant improvement just within 2 weeks. So that's very exciting new research in humans. Now, here's a wonderful survey published by Dr. Ethan Russo and a group of people who are well known in the cannabis world. And I thank them for their work. And so this was published in September 2021, and it's a survey of patients who are using CBG dominant cannabis, what their perceived medical effects, adverse events, and withdrawal symptoms. And so they recruited people online. There was a total of 127 people. They were all US residents over the age of 21. And they were using CBG dominant cannabis over the last 6 months. And the most commonly treated conditions you can see here, a little over 50% using CBG for anxiety, a little over 40% for chronic pain, 33% for depression, and a little over 30% for insomnia and sleep. Adverse effects, you can see 44% had none. And then there were a small percentage dry mouth, sleepiness, increased appetite, and dry eyes. And again, one wonders, were there other, was there THC in the mix? Because all of these things are associated with THC. I don't see this too much in my patients using CBG. So one wonders if there was a little THC effect there. And interestingly, really nice, efficacy was highly rated, with the majority reporting their conditions were very much improved or much improved, and with CBG. And, someone might say, oh, it's all placebo. Of course, they knew they were taking it. They sought it out. But at the same time, that's okay, because look at these nice high numbers. This is patients who are sometimes able to get away from pharmaceuticals that have side effects. And here you go. 74% claim superiority of CBG predominant cannabis over conventional medicine for chronic pain. 80% found it superior for depression. 73 for insomnia, and 79, almost 79% for anxiety. I mean, these are very nice numbers. So even if some of this is placebo, I would posit that some of these people are getting a real effect. And then 84.3% reported no withdrawal. I have not seen withdrawal from CBG in my practice. And 2 people reported sleep difficulties. So certainly, if you were sleeping better with CBG and you took it away, you might not sleep as well. You might go back to how you were doing before. In my practice, so I see a wide range of dosing. There are some people very sensitive to low dose. I've had patients take 2 milligrams and tell me that they get a good result, all the way up to 100 plus milligrams. I always tell people start low and go slow. 2.5 milligrams, an increase in similar increments every 4 to 7 days. You can take 1 to 3 doses a day, depending on response. CBG may be alerting or sedating, so you're going to see an individual response and dose dependent. It may not be either of these, but it's good to see what how you respond, excuse me, and at different doses. I highly recommend keeping a journal, documenting dose and the product specifics and the effects, because if something works for you and you accidentally, finish the bottle, threw it away, and now you don't remember what it was, that's not very helpful. So document. And this is what I've seen in my practice. So certainly a reduction of anxiety and depression, both in children and adults, reduction in pain and inflammation, a reduction of the psoriatic rash with oral and topical CBG, either separately or together. In autism, I see a subset of patients show improved anxiety, better focus, and increased speech. I've seen a reduction in hyperactivity in patients with ADHD. And one particular patient who has severe autism and just really suffers with gut issues and very, very constipated. We added CBG for behaviors, and we were hoping to help with speech and anxiety. And lo and behold, this is what allowed this child to have normal bowel movement every day. And when he goes off of it, he doesn't go. And when he goes on it, he does go. So very interesting result there. Now here I just posted some products. I've blocked out the names just so not to endorse anything particular, but you can get hemp flower to vape. There's some companies that sell CBD, CBG combo topical. And notice this says about 350 milligrams of cannabinoids. Here you've got 500 full spectrum CBG. This is also a topical, and then some tinctures. It's important to pay attention to label. In this bottle, when it says CBG 700, that's 700 milligrams in the whole bottle. It's not 700 milligrams a dose. And it tells you in each 1 ml. So 1 ml is, usually these eyedroppers are marked 1 ml. There's also a 1 ml syringe, which I'm looking for here. I can show you a little 1 ml syringe. You see that? And you can buy these, they're needleless. You can stick it in the bottle. And I really highly recommend using these syringes because you can just pull up the dose that you want. It allows you to accurately measure. So for instance, on this one that says CBG 700, very nicely, they label 24 milligrams in 1 ml. That means if I took 1 ml, one whole syringe, 1 ml syringe of this oil, I get 24 milligrams. And I want to point out that these syringes are marked off at 0.1, 0.2, 0.3. If I only take 0.1, that's a tenth of the total. So it's 24 milligrams, a tenth would be 2.4 milligrams. You can accurately dose with these syringes much better than the eyedroppers that come with these products. If you look here all the way to the right, you see this one is 1,200 milligrams in the whole bottle. And it tells you right there, 40 milligram per ml. So that would mean if I did a whole syringe of that, 1 ml, I'm getting 40 milligrams. Well, I don't want to start with 40. So I might do 0.1, which is going to be 4 milligrams. Remember, it's just 1/10, divide by 10. That means each line is going to be 4 milligrams. So 0.1 is 4, 0.2 is 8, 0.3 is 12, and so on. These make it very easy to measure. So I just wanted to share with you that CBG is available in multiple forms. And for most people, they do start with tincture or topical before they go to inhaling. But certainly I have seen, I have a teenager uses CBG and vapes it with a volcano vaporizer, and he gets terrific relief of anxiety. And also if he's having a panic attack, it just cuts it. And he's not intoxicated. And that's the best part there for him. So he can continue to participate in school and sports. All right, very good. That's the end of my talk on CBG. If you have any questions, feel free to post in the comment section. I'm going to try to answer all questions. Again, this is my book called Cannabis is Medicine, and I hope you found this helpful. Have a wonderful day, everybody. Take care.